I'm Dr. Freston. I'm an associate professor of the Department of Emergency Medicine here at Kasturba Hospital Manipal. I'm also the coordinator for the Center for Wilderness Medicine and Manipal Scuba School. And I'm here to talk about One Health today. One Health actually is very important in the current times. It's basically the intersection of human health, environmental health, and animal health. It basically tells us that when we're looking for health, we need to understand where that problem starts and where it ends and how everything is interconnected. If humans are ill, there could be a reason for that because of ill health in the environment. It could be because of ill health in animals. Establishing those connections helps us understand the exchange of disease in a better way. For example, if I get a patient with an infectious disease coming to our emergency department and we are able to establish that it's a disease that's come through ill health from animals, and ill health from animals may be caused because of environmental degradation, for example. So this interconnection, once established, helps us, those who are involved in public health and who are collaborating together, to go in and find out what are the ways we can solve it to prevent this from happening altogether. So the important concept is that we should not isolate ourselves and say, okay, I've got a sick patient, I'm only going to treat this patient and that's the end of it. We need to collaborate. We need to collaborate with veterinarians, with the forest department, with the public health expert, with the policymakers, with doctors and the general public, because everyone is a stakeholder. Everyone has to come together for the good health of humans, the environment and animals. That ecological balance will allow us to have longer health for a longer period of time in times where pollution is a problem, where sewage water is contaminating our seas, where industrial waste and fossil fuels are contaminating the air, where deforestation, monocultures are affecting our wildlife, and there's an exchange of disease from domesticated animals and wild animals. Just imagine, take rabies for an example. Rabies actually is hosted in wild animals. The interaction of stray dogs with wildlife establishes that exchange, and vice versa. That results in degradation of the wildlife, and that results in the spread of disease in ecologies that are otherwise imbalanced. That imbalance can lead to maybe a rise in tick populations, for example. A rise in tick populations can result in tick-borne diseases in humans, or the spread of rabies to humans through animal bite. So if we understand these problems from all these three aspects, we can then help solve it and prevent it altogether. So that's what One Health is about. It could be applicable also to the marine environment. Say, for example, we're looking at our fish stocks and fish supply. If we're contaminating our seas and fish die, we don't have food. We don't have food, that leads to human ill health. So it's related to all the different kinds of ecologies that we have, and you can take it at a very broad level, looking at Earth as a whole, or you can come down to a very simple grassroots problem related to one disease alone. Which is why now, here in India, we have an organization called the Center for One Health at the National Center for Disease Control. They are doing a lot of work in bringing One Health into perspective to solve various disease burdens that our country is facing, and it's similar globally. Two of the areas which we are specifically working on right now is snake bite. There's an action plan for prevention of snake envenoming, and similarly for dog bite. And the perspectives are from One Health and bring all these collaborators together to solve these problems, ensuring that there's good health for animals, for the environment, and for humans. I think I can give an important example here. It may or may not be true, but it might give us some perspective. If you think about the lion-tailed macaque or monkeys, for example, here in the Western Ghats, they rely on fruit-giving trees, flower-giving trees, from which are native to this region. Now imagine we chop down the forest of native species and we plant a cash crop, say like acacia, for example. Now we've taken away their food source, and they would otherwise have lived in that forest feeding on those mature trees that provide them fruit. But now this is suddenly lost. They are displaced. They come closer to humans and they look for food from humans. They now have ill health. They probably carry some disease, which if it gets exacerbated because of their ill health, they could then spread it to humans. This example is applicable to one of the diseases that is endemic to this region, which is Kyasanur Forest Disease, which is a virus basically, which is spread through ticks which bite monkeys. When monkeys die and there's ticks in that area, those ticks, if they bite humans can get Kyasanur Forest Disease. So that interconnectedness and relationship of the spread of disease, vector-borne diseases, is applicable to environmental degradation. Similarly, as I already mentioned, in our seas, coral reefs are very important. If we are putting antibiotics into our rivers, which are then going into the sea, we are putting sewage waste or industrial waste into our rivers or directly into our sea. It's going into those spaces, it's changing that biochemistry. It's probably even to some extent resulting in some amount of antimicrobial resistance. There is some research out there which says that there are antibiotics in our rivers and in our seas. So how does this impact us and then antimicrobial resistance? We eat the fish from the sea. There's heavy metals that get concentrated in the sea when we eat this fish, like mercury, for example. There can be high levels of mercury in some places. And if we eat that fish, that mercury can cause neurological problems to humans. So it's all interconnected. We need to understand these interconnections and be conscious of it. Even as citizens, throwing garbage into the river, into the sea, letting our sewage go out directly into the sea without processing it. All of this has an impact on human health. We should be conscious of it. So, as I said, it's really important for all of us to participate. It's not just up to the doctors. It's not just up to the government. It's not just up to the veterinarians. Every citizen should practice One Health. We should preserve our forests. We should preserve our native biodiversity, both plant and animal. Allow them to exist in harmony and balance. We should be conscious of what we're doing with our waste. We should not burn it unnecessarily. We should not bury it without processing. We should not let runoff go into our rivers and our seas, which provide us with food and water. We should not contaminate our ground. And all of this starts in our homes. Simply segregating your waste, being conscious of what you spend and what you use, how much plastic waste you're creating, because it's going into a landfill and that landfill has a runoff and that runoff goes into our streams. And somebody is going to drink that water. Maybe it'll go into our well water. So in these times where our population is growing and our resources are reducing, we need to be very conscious of preserving our environment and preserving the planetary health from a One Health perspective, because it impacts us all eventually. So it all starts at home.